Harrington? Harrington, what are you doing up there? All right, now don't take this personally, but you're gonna have to go.
Fran. Is this okay? Fran. You all right? Oh, God. Fran? Yeah, I need an ambulance at 500 North Sycamore. I don't know. My friend collapsed.
What were you doing when you fainted?
We were just looking for her cat.
Have you banged your head recently?
No?
Is this a motion sickness patch?
I must have forgotten to take it off. I just got back from a trip.
Oops. Scopolamine can cause dizziness and blurred vision. You probably hit your head when you fell, and that caused the blackout.
I thought those patches were supposed to prevent you from getting sick.
Every drug has a side effect, but it might be a good idea to keep your eye on her for the next few hours to make sure she's okay.
Oh, actually,
She has to get back to work.
Is it important?
We just don't like people to be alone after they leave here.
I'm fine. Really, I'm...
Fran? Fran?
I got a seizure, a code card.
What's wrong with her?
I have no idea.
I turned 58 last March. Same age my mother was when she died. Next week, I packed a bag. I went to JFK, looked at the big board, took the first plane that went to a warm place. Caracas.
Oh, my God.
Did you drink the water, eat salads, any raw foods?
Yep.
And?
I also did mezcal shooters and snorted cocaine from a homosexual man's stomach.
Did you have sex?
No. Not with him. I had sex with El Gordo. He was a large man.
Oh, my God.
I never do things like that. I should have gone to visit my sister. It was stupid. That's why I'm sick, isn't it?
It's possible.
Can't wear motion sickness patches for the rest of her life.
No, but if it does relieve her symptoms, it'll narrow down our search.
Anything else you two guys want to agree on?
You have a problem with us agreeing?
No, I have a problem with the other thing you're doing, which makes me question your motive for agreeing.
I'll put her back on the patch. What else?
It's got to be something neurological. We should do a CT, look for a brain tumor.
Could also be an allergy or something environmental. We should check her home.
A bit more likely she got sick in Caracas than in New Jersey.
Right, I forgot there are no toxins in the U.S.
I think I'm starting to feel sorry for House. Get a tox screen, Chem 20, STD panel, blood cultures, then you run a CT, and you check her house.
Think we should feed the cat?
Bowl's full. If he wants it, he can get it. Cadmium yellow. Heavy metal poisoning would explain the ataxia and the seizures.
Unless she was painting with her tongue.
Is Foreman right? Did you agree with me because of our relationship?
Relationship?
You know what I mean.
You mean because of our lack of a relationship?
I mean because we're having sex.
Yes, Foreman's right. I thought you were completely wrong about the medicine, but agreed with you anyway because I figured then you'd do me in some old lady's home.
Then well played.
Come on, we're supposed to be looking for toxins.
We agreed it was a brain tumor. What?
He's watching.
Haven't you had anybody watch before?
What'd you find?
Nothing in her house. Big waste of time.
Medically?
CT was a complete waste. She was negative for tumors, her blood was negative for drugs, heavy metals, tropical diseases, food poisoning, and STDs.
Also no sign of lead poisoning or sepsis. Apparently, Venezuelan tattoo parlors have standards after all.
Good to know.
We sure she's even sick?
2 more seizures in the last 2 hours.
Which is slower than she was having them before you put the patch back on.
I'm an idiot. She's exposed herself to so much crap, I just assumed it was a zebra. It's breast cancer.
Since when is breast cancer treatable by motion sickness meds?
It's not, but the inflammation caused by the paraneoplastic syndrome caused by the cancer can be reduced by anticholinergics.
Still. Okay, we're gonna get just one more. Sorry, I know it hurts.
It's not that. It's my eye. My right eye. I can't see.
Poly spikes over O1 and O2.
That's her left eye. Burst suppression on every lead.
Fran? She's comatose.
She needs a burr hole to
You want
relieve.
a drill in her brain because of an invisible bleed the CT couldn't see? You should do an LP to confirm the presence of red blood cells.
And her brain herniates, and then she dies.
Right, better to kill her in the OR. Chase, what do you think?
Here's a cliffhanger.
I think it'd help to know what she has before we start digging into her brain.
Might be better to play it safe to start. Do an LP.
Sex better be damn good.
We had sex in a patient's bedroom, a bedroom we were examining for toxins. Yeah, our judgment's right on the mark.
All right, no more sex at patients' homes, no more sex with cats watching. Anywhere else you want to cross off the list?
The bowl.
What?
Has she eaten since she's been here?
She's been sick since she's been here.
What if it's a symptom?
Why would you think
The
that?
bowl was full. Years ago, it was one estate. The 2 homes shared an electrical system. Unfortunately, the exterminator didn't know that, so when they fumigated next door, the poison gas flowed through the old pipe and into your house.
The scopolamine patch was masking the effects of the poison. You'll have to stay here for a few more days, but after that, you should be fine.
I'm sorry about your cat.
And your hair.
For 12 years, Harrington never left the property. I thought I was being punished for going away, but really, I was being punished for coming home.
Casey Alfonso with an amazing finish. What'd you do at the end there?
Yeah. About 250 feet, the car got out of shape a bit, but about halfway down, I just got into the zone or something. I pedaled it back into the groove. It was the coolest ride of my life.
How does it feel to beat 9-time national champion Tony?
I'm sorry. Can you repeat that?
Case, out of the way! Out of the way! Casey! Casey, get the ambulance! Frank, get the ambulance! Casey!
Keep your eye on my pen. Very good.
Any nausea or vomiting before the seizure?
No. My dad had some, but he's always like that before a race.
Could have been food poisoning. You two eat breakfast together?
No.
Any history of sciatica or spinal injury?
No.
Abnormal deep tendon reflex.
Really? Let me see. It's there.
I didn't say it was an error. I said it was abnormal.
We're gonna give you an MRI to be sure, but I'm guessing your symptoms were caused by just dehydration in the heat.
You're guessing. Look, I make a living driving 300 miles an hour, which makes the ability to stay conscious kind of important.
I'm sure it's just heat stroke, but we're gonna do an MRI to be extra careful.
Have you considered Miller-Fisher?
Why? What happened?
She just had another seizure, and now she's getting a vertical nystagmus.
We think it's Miller-Fisher, an inflammatory process. In rare cases, it can cause respiratory failure, but...
Wait, should it stop breathing?
You said there was nothing wrong. You said you were sure.
We just had another seizure. Clearly, there's something wrong.
So why should I trust you to figure out what it is? Where's Dr. House? I'm at this hospital.
It's gonna be all right. We just need to start the plasmapheresis.
No. It's not going to be all right because you obviously don't have a clue what you're doing. I'm not letting you touch me.
Honey.
I want to see House. Where is he? What do you want?
I'm gonna do what doctors aren't supposed to do. Admit I made a mistake. I shouldn't have been so quick to dismiss your symptoms. But you need to let her start the plasmapheresis.
What do you want?
Case? Honey, do you know where you are?
She's burning up.
Start the treatment.
We can't.
You've got my permission. She's obviously
It
confused.
doesn't matter anymore. Miller-Fisher doesn't cause delirium and fever. I don't know what this is.
Okay, drum roll. LP is negative for meningitis. Sorry, Cole. Fat pad biopsy is... Oh, wait for it. Negative for amyloidosis, and 13 goes down.
Could we hurry this up? My son has
I have a kid, too. I'm working too hard.
I could hook you up.
If I had 2 minutes and some anti-nausea meds, I'd take you up on that.
And for the gold...
Protein 65, glucose 70. It's MS. Start on interferon.
Turn to the last page. Cedric's 95. ANA is weekly positive.
Positive, it's lupus.
Weekly, not lupus. It's MS.
We obviously don't know what it is. Treat for both.
No, I gave in on the test. We're not treating her for two completely separate diseases because you think lupus will win you a prize.
Still think it's lupus?
Yeah.
Me too. In case of emergency, go to the emergency room. Fever's down to 101.5.
Treatment's working. Why are we out here?
Trying to figure out which treatment's working. It's kind of tacky doing it in front of the patient.
You put her on steroids too?
We had no choice. The SED rate pointed to lupus.
And the ANA ruled it out.
Doctors!
Legs hurt?
I can't feel them at all. I don't think I can move them.
Given its quick progression, we...
Polio.
Brilliant. We should search her home for FDR's remains or a time machine.
She could have contracted it from anyone who's been to Africa.
She's been vaccinated.
Vaccines wear off.
There hasn't been a single American case in over 20 years.
I've seen this disease. I know what it looks like.
That's why you're finding it, because you're looking for it. Polio. It's crazy.
House wouldn't think so.
So go find House and tell him your theory. Take a personal day. Seriously. Get out of here.
You don't have the power to fire me.
But I do have the power to kick your ass off my case. I'm starting the botulism treatment. The rest of you look for confirmation. You tested her without telling me?
Yeah, I know. I'm really, really sorry. But on the other hand, it's positive. She has polio. Now what, boss? We're gonna attempt an experimental protocol.
A new drug?
An old one. Vitamin C. Ultra-high doses have been shown to destroy the polio virus and heal nerve damage.
She could regain use of her legs.
It's unlikely.
But we're gonna try. Don't give up.
Why is she shivering?
Low serum calcium is a side effect of the treatment. I can give her a calcium supplement.
My arm hurts.
Infusion rate has to remain high for the treatment to work.
Is it working?
You feel that?
Yeah. It hurts.
It's working. This is fantastic.
You think it's more likely he cured polio?
Well, they believe it. Her symptoms fit perfectly. And the alternative is unbelievably convoluted. Some doctor would have to poison her with thallium so it looks like polio, then fake a lab test, then give her vitamin C and stop the poison so she magically gets better. Actually, it is kind of doable, right? So what do you think? Should we test her for thallium before you contact Stockholm?
You poisoned her?
Really shocking thing is that Foreman was right about the heat stroke.
Vitamin C cures polio. I've seen it.
Yeah, in some bush clinic. You needed polio in a place with a proper lab. The only problem is that places with proper labs don't have polio.
There is no money in finding cures for diseases that only kill poor people.
This will make them do research. What do you care if I faked a lab test if it saves a few thousand lives? I did what I had to do. Isn't that what you hired us for?
Which is why I'm not gonna fire you. You're gonna quit. Go on, get out of here.
So you're just gonna let him go?
Absolutely. I'm gonna let him get as far away as possible before you call the cops. The guy's a nut job. Who the hell did I leave in charge?
Foreman.
There's a reason for that. Next time, listen to him.
Where are you? Damn it! Damn it!
Damn it, Vince!
Ah. That blood look funny to you?
Still working on it. The code's a little janky. Hey, boss, you just like watching us get our asses shredded?
Yeah, not that you're not hilarious, but we hit the shelves in 3 months. Vince?
Vince, what's wrong?
My hands, they're on fire. This guy came in with burning pain caused by erythromelalgia caused by mercury poisoning.
Who needs actual doctors when you got the internet?
Well, no offense, but doctors make mistakes. Medical errors are up 30% this year.
You should check the rate of patient error.
There's a ton of information out there. Why wouldn't I educate myself, be my own advocate? CRPS came up in my search too, but I've never had any skin discoloration, and my pain is sporadic and not constant. It's gotta be worth one lousy blood test.
The blood test ruled out mercury poisoning.
What was my mercury level?
2.8. That means for every deciliter of blood.
I know what it means. I also know it's above normal. I want mercury chelation.
Your level isn't elevated enough to produce your symptoms.
You can't know that until we de-elevate it and see if my pain improves. It's a judgment call.
Based on 10 years of medical training? I think you have CRPS. I want to try spinal stimulation.
So basically you want to shove a needle in my spine based on a glorified hunch. I'll stick with the chelation.
If you don't want to get better, I think we're done.
What do you mean, done?
You're not interested in my medical opinion. I'll move on to my next patient. You'll move on to a doctor willing to run all the unnecessary tests and procedures you want. Or you can stick around and be cured. Makes no difference to me.
Is this supposed to hurt?
Not if we're in correctly. Is it your hands, your back?
No, my chest. Can't breathe.
Heart rate's 140, climbing.
You need to hold still.
What did you do?
Deep breath.
His lungs are filling with fluid.
Analysis of the fluid from Vince's lungs shows the lung problem is really a heart problem. He's got a thickened left ventricle.
When his heart sped up during the procedure, it jacked up the pressure in his lungs, causing pulmonary edema.
Good thing I talked the patient into spinal stimulation.
It did lead us to discovering a new symptom and proved he was wrong about mercury poisoning.
We lucked into that discovery, and we were wrong about CRPS. Ventricular thickening plus neuropathy could equal Lyme disease.
Not without joint pain.
When's his new game coming out?
Couple months.
He's probably working nonstop. Might be using more than coffee to power through.
Cocaine use explains his symptoms.
So we search his office for drugs.
That's one
big-ass bird.
It's kind of amazing the way the wings move. It's so real.
Get them off me!
I know what's wrong with the patient. I'm going to call Foreman.
Little help. Your partner said you studied birds to improve the game animation. Did you touch them?
Can't dissect without touching. It's the best way to understand the anatomy.
It's also a good way to contract an infection called psittacosis. We spoke to Dr. Foreman. He wants to start you on antibiotics.
Does that infection cause problems in the joystick area? Kind of stuck in play mode.
Yes, we get it. She's very, very pretty.
It's not her. I mean, it was. When she was here with her boyfriend 3 hours ago.
You've had an erection for 3 hours?
At first it was just embarrassing, but now it's really starting to hurt. Will the antibiotics help?
I'm afraid not. This isn't psittacosis.
His lymph nodes blew up. He's been treated for thrombocytosis, but there's been no change.
I was wrong.
God, you are a genius. I'm adding this to my list of symptoms.
That didn't work last time.
Because I didn't think big enough. Now I'm offering a $25,000 reward.
Your stunt generated quite a few responses. Let's take a look.
I'm way ahead of you.
Paraneoplastic syndrome secondary to spinal tumor.
No hypercalcemia, no muscle spasms or incontinence.
You are possessed by the biblical demon Legion.
No jumping off a cliff in a herd of pigs.
Otherwise, it did fit. Graves' disease.
Nope, thyroid levels are normal.
You want us to spend the next few days shooting down every theory in the world? Or can we do our jobs and come up with one that works?
I want you to test me for amyloidosis.
That's your professional opinion?
It's the wisdom of crowds. Studies show the collective decision of a group can be more accurate than any individual's decision. Went through my emails, amyloidosis got the most votes.
If you had amyloidosis, there'd be speckling on your cardiac ultrasound.
In 100% of cases.
Fine. I'll make you a deal. We'll do a kidney biopsy to test for amyloidosis. When it comes back negative, you pull your case off of the internet and retract the reward. It's either that or I don't test you at all.
Deal.
Foreman. Hallucinating because he's burning up. Amyloid doses wouldn't do this. We think you have a disease called LCDD. It causes proteins to build up in your organs.
You think?
We can't definitely confirm the diagnosis. And the only chance of beating this would be to start you on high-dose chemotherapy. But I do have to warn you that in your condition, it might kill you. Do you want me to get you some more information?
You're my doctor. I trust you.
No, you don't. You're scared, and you don't want to make this decision. My career is writing on this case. Nowhere near as important as your life. But I think the best shot for both of us is to treat for LCDD.
Okay.
Stop the chemo. He's got Fabry's disease. He was in the tub for an hour. His fingers should have pruned, but they didn't.
Already stopped chemo and confirmed Fabry's.
I'm glad you both agree, but could somebody loop me in here?
We assumed the deposits in your kidneys were proteins, but they were fats. Fabry's makes them build up in your organs, choke your nerves, keep your fingers from pruning in water. It's chronic, but manageable.
How'd you figure it out?
Iodine mumps. His lymph nodes swelled up after the head CT. We thought it was a new symptom, but it wasn't. It was a reaction to the contrast. Iodine mumps takes lymph nodes off the table. Remove that symptom.
And that just came to you?
I looked through the online responses again. Someone posted it this morning.